Welcome everybody to our webinar, and I just want to introduce us. My name is Elisa Bronfman. I'm a psychologist, and I've been at Boston Children's Hospital for 23 years working with kids with medical illness. And I want to introduce my colleagues, Annie Banks. She's a social worker in the Center for Families, and she has been a social worker for 30 years. And also my colleague Gail is a child life specialist, Gail Windmueller, and she's been a child life specialist for 11 years. We're going to talk to you today about the concept of how to help your kids get through vaccinations, blood draws, pokes of all kinds. We're going to talk about how parents and caregivers can help reduce child anxiety. We're going to talk about giving honest explanations and communications to children, the importance of preparation for medical care. We're going to give you some specific strategies to use in preparation to improve child coping and hopefully your own too. We're going to talk about when is scared of needles actually considered needle phobia and when you might need additional mental health support. We have a plan also to share these slides with you because we think the slides are valuable. We're going to share them with you maybe several days after the seminar, but this is going to be recorded and we're going to have a link to it, or we're going to find a way for people to rewatch if they were interested. And we're also going to try to get anybody who attended today the PowerPoint from this presentation. So we have a video from Montreal Children's Hospital that's just a short clip highlighting some of the strategies and some of the problems that happen.
Hi, how is everyone today? You're gonna get some needles today, young lady. Yeah, we are.
You know, Mom, it doesn't really have to be this way. I know you're afraid of needles, but I don't have to be. You can distract me with some fun games and get me to take a few deep breaths and play mind salad. You can even put a special cream around so the needle won't hurt you. This could all be a lot easier. Still use topical headaches to help. Do the song we skin or the sing a song. Do the chords to take some deep breaths and play with mind salad. Don't tell me it's gonna be okay. Don't tell me it'll be all right. That can make me feel it's better to fix my mind up. Morning, what don't tell me. Come here, Bubba.
It's been really helpful for me. Please share this with your friends. Remember, distract, take deep breaths, use topical anesthetics, and don't say, it'll be okay, or it'll be over soon.
So our goals for getting kids needles, immunizations, blood draws, the point is to get medicine to children or information from a blood draw, but it's also really important to us that the child feels safe, secure, willing to return, and that they associate Children's Hospital with a positive place to be, somewhere they had a good experience, somewhere that helped them. Medical fears are very common in children. In addition to fear of needles and blood draws, kids are afraid about being examined, swabbed, taking off their clothes, blood pressure cuffs, thermometers. Many parts of the hospital and hospital procedures are scary to children. So it's very normal. And it's estimated that 25% of adults fear needles. Even more kids, of course, fear shots and blood draws. So that's what we're hoping to help you with today.
So, parents and caregivers, we can all help reduce kids' anxiety. And lots of studies have found that parental behavior is really one of the main predictors of how a child is going to respond in a medical setting. If you seem relaxed, your child will be more relaxed too. So how do we get you more relaxed? Well, consider ways to manage your own anxiety about the upcoming poke for your child, such as breathing, making sure you're grounded, which means you can, making sure that your feet are firmly planted on the floor if you're sitting or standing, visualizing a positive experience for you and your child, and take note of pleasant sounds or smells or sights in your surroundings or whatever you do to relax. Calm is absolutely catching, and our kids are looking to us as models. So, as I was saying, you can model calm, positive coping. First, you have to get relaxed yourself. And when we're anxious, it can really make kids scared too. So things that you can do to model calm, positive coping with your child: smiling, talking about neutral topics that have nothing to do with the poke or the doctor, noticing things in the environment, and also assure your child that you will not leave them, that you will be there with them and they won't be alone. Ironically, being empathic toward distress, like saying, oh, that must really hurt, that must be very awful, actually can really enhance distress. And that's kind of counterintuitive, but the best thing to do is show confidence in your child, make statements like, you can do this, you did it. That will improve outcomes and feelings. And so you can be positive without ignoring your child's fears. And really, you just need to have faith in their resilience for getting through this challenging situation and other challenging situations. So one of the best ways to do this is, have honest communication and explanations. I think we often think that if we just kind of don't tell them what's going to happen, it won't be as scary. But in fact, being really honest and clear at their level helps them feel much more in control. So children need accurate, non-threatening, very simple descriptions of what they'll experience to promote positive relationships with their providers going forward, and to be able to trust you, to know that you'll be honest in this situation and other situations. Talk with them about what the space is going to look like if you know. You can get in touch with the hospital and or where you're going and get a plan of what the space is going to look like and what they're going to confront. Also, explaining to a child why they need a poke can really be helpful, so that they have some understanding. So like the doctors need to look at your blood and make sure that it's healthy, or vaccination will keep you from getting very sick. That helps them get through. Here's some other statements that might be helpful when you think about honest communication with children. Be honest that the poke is hard. So you don't have to make a big deal about it, but it is difficult. So you could say getting a poke is not your favorite thing. I know that. Remind the child of past successes. You did it before, you can do it again. And again, I'd say past successes in this kind of situation and in other situations. You've done hard things before, you can do this again. You can help your child script their own positive response. So talk with your child and come up with words from them that they make for themselves. For example, I don't like it, but then I'll have less of a chance of getting the flu or COVID. Or I know it's uncomfortable, but then it's done and I get a prize. Or simply, I can do it. I believe that I can do it. These are scripts that really help kids feel like they're in control. So you can tell preparation is very important. It is essential for kids and for parents. We all do better in these kinds of situations when we know what to expect and there are no surprises. Because when there's the shock of an unpleasant surprise, it can make future situations scarier. So preparation also includes preparing how to cope and having a plan for dealing with the visit and the poke. Again, this is about helping your child feel empowered and in control, and helping you feel more empowered and in control. So we're going to review some specific strategies to use in preparation to improve coping. We'll be talking about the following strategies: medical play, use of choices during procedures, relaxation techniques to practice with your child, distraction, pairing and reinforcement, comfort positions. We'll show you some holds. Coping script and my hospital story. We'll describe what that is. And advocating for pain control by calling ahead of the visit. So now I'm going to pass this on to my colleague, Gail.
Hi, so I'm going to be first talking about I'll be talking about all the different strategies that we can use. One of the best ways to prepare a child for any kind of hospital visit or medical visit is to allow them to play with medical-like materials. Mr. Rogers always said that, people think of play as a break from their work, but in reality, for a child, play is their work. That's how they're doing their serious learning. So it also allows the children to express their feelings and gives them a sense of control over the situation. So what we do with medical play is we'll let children play with their dolls or a stuffed animal and use either a play medical kit or just some real Band-Aids and Q-tips and cotton balls. You can get an oral syringe at the pharmacy, one that kids usually take medicine with, but it's just like a regular syringe, except there's no needle. And you can also ask your provider for some supplies. A lot of times they'll provide it for you if you explain that you want your child to practice and play, do medical play and pretend they're the doctor. And the other thing that can happen is when you're playing with them, you can find out that they have some misconceptions or misunderstandings about what's going to happen. And this is an opportunity for you to clarify what actually is going to happen. Kids have a great imagination, and sometimes they think something is going to happen that isn't going to happen, or they've misunderstood it because they hear things concretely rather than what we mean. Like a blood draw is not coloring with crayons. It's a blood draw instead of drawing, with crayons. Next, we're going to talk about another kind of medical play, which is using the medical equipment, but in a fun way. For example, these two pictures show one boy using a syringe for painting and another one using it with water. And even in a bathtub, using a syringe can be a lot of fun. And it changes the way children perceive what a syringe is. It becomes less negative for them. And they learn best by using them and doing things with their equipment, with the equipment. Another important thing for children when they're coming into a doctor's appointment or coming in for a procedure is to have opportunities for choice. Most kids walk into a doctor's office and feel like everything's going to happen to them and no one's going to give them any choices or ask them questions. It's all going to be, sit on the table, do this, do that. I'm going to listen to your heart. But if we can incorporate questions that are realistic, choices that are realistic choices, that can help them feel in control. So for example, if you ask your child, do you want to sit on the chair or do you want to sit on my lap? That's a realistic choice that we can live with the answer, because whichever they choose is going to be okay. Now, if we ask them a question like, would you like to sit on the chair? Is that okay? They can say no. And then what are you going to do then? It sort of leaves it open-ended. So you want to make sure that the choices are very clearly defined and that they can choose one or the other, and that you and the professionals, the doctors and nurses, will also be comfortable with the answer they give, that the child gives. The other thing about choices is a lot of children try to procrastinate things happening. And so they'll drag out their decision making about their choice. And it's very important to make it clear that these are your choices and we need an answer. Because the more time that passes by, the more anxious a child becomes. So reducing the waiting along with the quick intervention is usually the most helpful way to go. Another choice that is also very important to offer is, do you want to watch your shot or your blood draw, or do you want to look away, or do you want me to help you look away? That gives children control, but a lot of times, believe it or not, they change their mind. So it's okay to let them change their mind. If you have a book blocking their view from an IV or a shot and they push the book away, let them push it away. It means they've decided they want to see what's going on. Now, some strategies for relaxing. There's different types of breathing techniques that you can use. The first one is something that I use and my children use on a regular basis when we get stressed. So it's not just related to medical situations. It's anytime you're stressed. If you breathe slowly in through your nose and then out through your mouth, and just do that over and over again, your whole body relaxes and it's much easier to get through anything that's causing you stress. And in addition to that, another kind of breathing is related to when a child's getting a blood draw or a vaccination. If you ask the nurse to count to 3, and while the nurse is counting to 3, you breathe in, big breath, and then when she gets to 3 and does the poke, you give a big breath out. That makes your body relax, and it makes the IV easier to access, and it makes the discomfort of a vaccine a lot less. There's some other types of breathing practice that kids can do at home that can be really fun. One is to pretend you have a birthday cake. There's also a birthday cake app that if you blow on your phone, the candle goes out. So that's kind of fun. I think it's just called birthday candles. Bubbles are great to use, but currently Boston Children's Hospital doesn't allow bubbles because of COVID, and blowing isn't highly recommended with COVID. But to pretend there's a big bubble is a great way to go. And the other fun thing to do with kids is giving them a ping pong ball and a straw, and they push the ping pong ball by blowing through the straw, and it'll make the ping pong ball roll across the table or through a maze or across the floor. And it's a great way to practice breathing.
There are lots of other resources for relaxation for those of you that want to practice at home and learn more about relaxation. There are many great apps, Headspace, Calm, 10% Happier. I recommend, if you're going to allow your child to use these, that you demo them yourself and pick one that you think your child will like. There's also Yoga Kids has some relaxation programs, Indigo Dreams, Ocean Dreams. You can buy those on iTunes. They're stories, affirmations, some body scans for relaxation as well. I like them. Several kids who had trouble sleeping and listened to those Indigo Dreams are suddenly sleeping, which is another side effect you might like at some point. There's also, if you want your kids moving more at home to get relaxed and to when they're really feeling overly active, Go Noodle is another good example for younger kids. And also for older teens, self-help books can be helpful in learning relaxation strategies, including breathing and other strategies for learning to relax. What to Do When You Worry Too Much is probably the most popular book by Don Huebner, who has a whole series of books on managing different feelings for, I would say, the 10 to 15, 16-year-old kids. So we're also talking a lot about using distraction. So by distraction, we mean getting the kids' minds somewhere else. And it's important to think about this both before, during, and after the poke or whatever procedure you're coming to. So to come in with a coping plan, a toolbox of things you've thought of that will distract your child. So I think you can think, okay, should I bring a toy they haven't seen that's novel? Should I have a new something to watch on a phone or an iPad? I'd think about it well before the procedure so you're not searching or looking for something right while you're there. Think about the time period of something like an immunization or a blood draw as not just the time and when you're getting it, but the time going to the hospital to get it and the car ride. Your child could already be getting anxious in the waiting room, also in the procedure room, as well as after the fact as well. So we want to think about distraction as the purposeful refocusing of your child's attention away from the poke. And choosing the distraction should be part of your preparation plan as we're talking about thinking about it in advance. And you have to think about it developmentally for where your child's at. We're sort of thinking about, somebody had asked about newborns, and definitely you want to think about it for your newborn too. They may not know what's going to come, but thinking about being calm yourself and relaxed for them is a helpful thing to do. So they'll see how you're feeling. So doing things to relax yourself is going to be very important. And then thinking about what do they like, rocking, singing, eye contact, sucking a pacifier, nursing, toys with lights and sounds, things that attract their attention are important to think about for the very young babies. For younger kids or developmentally young kids, you want to think about how to keep them occupied. The idea is to involve them in something that involves their active participation is more distracting than, for example, just listening to a story. It's more distracting to have to pick up the pieces of a pop-up the book or a lift the flap book or to touch something on a phone or a device or an iPad or to even look in a Where's Waldo book is more active than just hearing a story. So something that's active and also something that can be done with just one hand. Because remember, while they're actually getting their poke, they're going to need to have one arm that's not involved in whatever distraction activity that you're picking, at least for that part of your plan. For those younger kids, there's a great app that was introduced to Annie and myself by Gail called Duck Duck Moose that has songs on it that kids can be engaged with, videos on your phone, such as puppy videos or anything your child likes, thinking about something they like, and potentially something that they don't get to do all the time, something novel and exciting. Puppets, and again, these interactive books, things that you can touch or be involved with. And then for our older kids, maybe work with them. If they're teenagers, they can work on developing their own playlist, thinking about riddles or Mad Libs, movies or television shows that you can watch together, thinking about fun conversational topics to think about, preferably not things that are stressful. I Spy game in the room is always fun. And there are apps on your phone or their phone that you can get them. A new app that makes it especially exciting, although sometimes that can be frustrating. So I want to give them a little lead time, but Spin Art, Cut the Rope, Where's My Water? These are good ones that you can try. What I'd say is, though, make sure these things fit with your family values, and it's absolutely fine if it's not a device, if it's something else, but if it's a book, have it be something that they can be involved with. Pairing. So pairing is when you pair something positive with a medical procedure and the child develops a positive association. So it's different than a reward because it's not earned. The example would be you're playing pleasant music while the procedure is happening, while you're getting a shot. That procedure feels just a little bit different because that's music you really enjoy. Um, it happens just after the event or while the event is going on. It could be also watching a favorite video, going to the park. Sometimes we want people to pair the hospital with fun things, such as, I forget what it's called, the thing that makes the bing bang that the ball rolls around. I remember the first time we bought one of those at the hospital, the first time we had one, and the chief of psychology said to me, "Do you know how much that cost?" And then he told me, I guess I shouldn't share, but it cost a lot of money. And I said, "Wow, that's a lot of money." And he said, "It's worth every penny for kids to come into our hospital and enjoy seeing something or have something that really involves them that they like, that they look forward to seeing, that's fun and not a procedure at our hospital." So I think developing those things, or you go maybe go look at the fish in the aquarium, or you go look at one of those bouncy balls things, looking at things on the walls in our hospital. Part of the reason they're there is we're trying to pair our hospital with things that are fun to look at and fun to do, other than coming in for help and procedures that are not what kids maybe look forward to or understand. So different than pairing, but in the same family of interventions is reinforcement. And that's where children earn a prize for doing, sometimes it can simply be for enduring the procedure. It doesn't have to be good behavior in the procedure. You can say, well, you're going to get this shot and afterwards you're going to earn something. Or it can just be that you say, if you prefer pairing, you can say, afterwards we're going to get blah, 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 or go somewhere, whatever it is that you're going to do, make as your plan. The key here is that we want you doing a little preparation with your kids. And in addition to creating a coping toolbox yourself to bring, it doesn't have to be a literal toolbox. It could just be a couple of things on your phone or toys that you've put in your pocket, a plan about how to distract your child, thinking about all the steps that they're going to go through in whatever procedure they're coming for. So let's say that it was a shot. And you should do this whether you're doing pairing or you're doing reinforcement, whichever of those you choose to do. Think about the steps they're going to go through in coming for a shot. So you could say, we're going to go in a car. We're going to get to the Children's Hospital garage. We're going to go to the 5th floor of the Fagan building, for example. Then you can also embed your coping strategies there. You can say, and then we'll play or we'll read your special Where's Waldo book. And then we'll be in the waiting room. If you want to, you can have a snack. You can put those things in your plan too. Just you have to make sure to follow through. And sometimes people really do it as a checklist. We're going to go in with the doctor or the nurse. You'll pull your sleeve up. Then you'll get your arm will be cleaned with a wet wipe or a wet cloth, however you want to describe that. Then your arm will have a little squeeze or gentle squeeze. And then you get the poke. And then either we'll go have this prize if there's going to be a small prize, or likewise we'll go pick something out, or whatever it is afterwards. It doesn't have to be a specific thing. The thing is, it has to be potentially something meaningful for your child. If you tell me I'm earning a prize of baseball cards, for me that's not a positive prize, but as I've learned earlier, that would be a prize for Gail's son. So you have to pick a prize that that person would like. And you don't want to give them a huge prize, which I know is also counterintuitive. Let's say I told any of us we were going to get $1 million to get a shot. That tells you that that shot is very dangerous. So you want it to be small, something that says this actually isn't that big a deal. It's something that we do. We think it's might be hard for you, a little hard for you, so you get a little prize.
And actually, with the baseball cards, what I would do, my son had several appointments that he had to go to where he had to get an IV placed. And we would open the cards as he performed each step of the process. So, they would have to pull up his sleeve. So we'd start opening up the pack, and then he'd get a band on his arm. We'd take out the first card and look at it. And we'd talk about the card. And he would tell me he knew a lot about baseball and would share about the player and if they're good players or he knows them. And it became part of the process of getting the IV, and it really helped him. The other thing actually I did with one of my daughters was I had a bunch of little small prizes that I knew she would like and wrap them. And then she would unwrap them. She'd get to pick one to unwrap each step of the way. So that's another way of giving reinforcement and also pairing positive things with the visit. Sort of does both. And then I'm going to continue to talk about other things we can do to help children when they're having their pokes. These are 5 different comfort positions. And you can, one important thing is that you talk to the nurse, because sometimes you might prefer a position that the nurse has a harder time doing the vaccination or the blood draw, but it's something to talk about. How can you hold your child in a way that will benefit them by feeling secure and snuggled and hugged, and that the nurse can also do what she needs to do. So the chest to chest is sort of giving your child a big hug with their legs around them. Side sitting is the same thing, but the arm is, sitting the child's back to your front, but the arm is much better exposed. With a baby, swaddling them up like you would after a diaper change, it's the same thing, but it gives them that sense of security. A side hug is for a child who's like sitting in bed and can't really get up and you can't hold them. And back to chest, if you look carefully, this mother has her legs wrapped around the child's legs. And that gives a little more security for both the child and for who's ever doing the blood draw, that if your child is anxious and might kick, this stops them from doing that, but it's a secure hug. It's most kids I've seen have that happen really don't mind at all that their parents are totally snuggling them. So these are suggestions for ways of sitting. And lying down, as it turns out, is actually not a great approach because kids feel much more vulnerable if they're in a lying down position and they feel less control. So if you can figure out a way to have them in a sitting position, one of these, or some variation of this, it can be very helpful. Next, actually, Elisa talked a little bit about this, doing a preparation story or a coping script. After you've talked about with your child all different plans, like maybe they've picked out a video they're going to watch or a prize they want, if they want to do basketball cards or baseball cards, whatever, is to make a list of the steps that they're going to take from the time you arrive at the hospital until you are leaving. And you can even have them illustrated if you'd like. If your kid is into drawing, you can make a book about what's going to happen and they can draw pictures of what's going to happen. But it's nice for them to have this special plan of what's going to go on during their hour or however long they're going to be at the hospital, whatever they're getting. And this can be generalized to procedures, not just for IVs and blood draws and other pokes. And again, including if you're going to do a special prize, if a treat at the end, or if you're going to do an activity after that makes the day special, like go to the park or something, that could be in this as well. The hospital offers stories that are already made. They're written from the child's perspective. They're called My Hospital Stories, and they're available if you go to the Boston Children's Hospital website and search My Hospital Stories. There's a list of stories that comes up for the Boston building as well as Waltham and all the other satellite locations. It has photographs of there's boy stories and girl stories of them coming in for various procedures. The one that's close is appropriate for this talk is the one that is called phlebotomy or blood draws. And when it's in the perspective of the child, the story will say something like, I'm going to the doctor today. We are going to go up the elevator. We're going to go into the waiting room. I'm going to stand quietly while my mother checks us into the waiting room, et cetera, et cetera. So it's all first person, and there's actual photographs from Boston Children's Hospital of the children, of a girl or a boy going into each step of wherever they're going in the hospital. It's not in every department, but there are a lot of the stories, and it's a growing library. So it's worth checking back because we're constantly adding stories to this. The other thing that most parents aren't aware of is that they have the ability to advocate for their child for pain medicine. We suggest that if you're going to do this, that you call ahead of time, because not all areas of the hospital have the different kinds of pain reduction techniques in their area, and you can call and ask. Also, sometimes because of allergies or because of um, illnesses that your child has had in the past or currently has. Some of these may not be okay medically for your child, but most of the time, something will work for your child that can help. So, for example, Sweeties, it's called, is a sugar, like a sugar water. It's 24% sugar, and the rest is water. It's for children that are newborns to 6 months old. And some articles actually say it's good until they're 12 months. There's sort of a mix. I've been reading some articles about it, and some of them do say that up to 12 months babies can benefit from this. It's a mild analgesic, which is a pain reliever. And what happens is 2 minutes before they're going to get their poke, you would give them, either you dip your pacifier in the liquid and then give it to the baby, or another type is this little tube that you can drip into the baby's mouth just on the tip of their tongue. And then when the procedure begins, you give them another like pacifier with the sugar water, and the analgesic effect usually lasts about 5 to 8 minutes. And you can sort of judge if your child's getting a little fussy and it's taking longer than expected to do, say, a blood draw, you can continue to dip the pacifier in and give it to your baby. The next thing I'm going to talk about is Elamax or Emla. This is a cream that comes in a tube. This you can ask your doctor for. They can actually give you a prescription for this. And what you do is, if the child's getting a shot, you put the cream on their arm, you cover it with a bandage, a large bandage, and it has to be 30 to 60 minutes before they're going to have the blood draw or the IV, because it takes that long for the skin to numb. But many children don't feel it at all. Some kids feel a little pinch anyway, but it's very effective. Cinera patch is another type of lidocaine, similar to the Elamax, but it's a patch that you put on the arm. There's no cream involved. Buzzy is a little thing that vibrates. It can be in the shape of a bee like this one, or it can be a ladybug, and it vibrates, and it also has the wings of the bee or the ladybug are frozen little ice packs. So it freezes the skin and it jiggles the skin. And for some reason, when you jiggle a kid's skin and do the vaccination at the same time, they feel it much less. I don't really understand why, but it works. And I've seen it work.
Gate control, they say. Anyway, sorry.
Yeah. And the last thing is a lot of the areas have freezing spray. They can just spray freezing stuff on their arm. Or you could even bring an ice pack with you if they're getting a vaccine and put the ice pack on their arm and numb their arm that way, which is very simple. Ice and freezing spray is not good for IVs because it will constrict the veins and make it more difficult. So the freezing and the ice is best for vaccinations, not for blood draws.
So
Okay.
thank you, Gail, that was great. So when is scared of needles actually needle phobia? So because so many kids are scared of needles, it's almost strange when children aren't scared of needles. And most kids are a little afraid of something that's going to pinch or hurt, or they think will pinch or hurt. So, how do you know when it's gone to the point of needle phobia that you might want to get professional help for your child? So, here's some questions you can ask yourself. It's on the next 2 slides that you can look this over. But the first one is if the child has repeated problems with medical care, maybe more than other children that you know, or the fear is out of proportion to the situation. So that might be, we go back one more just so I
I'm sorry.
cover all of them. No, it's okay. Fear is out of proportion, meaning that they might say, I wonder if I'll die. Will the shot kill me? Will all my blood come out if I'm getting a blood draw? These are out of proportion, distorted kinds of ways to think that you obviously want to correct and talk to them honestly about, but show that they're having more anxiety than you would expect. When they avoid getting medical care, when they hide in your home, when you tell them you're taking them for an appointment, when they seem extremely terrified, more distressed than you would expect, screaming and crying. You can tell on their face that they're just beyond terrified. When they think about the procedure outside of the situation more than you would expect. Now, you'd probably tell them we're going to go get your vaccination tomorrow. You might tell them that the day before, depending on the age, more or less time on that. But you wouldn't expect them 2 weeks ahead or a month ahead to be asking, am I going to the doctor? Am I getting a shot? Or to continue talking about it weeks after a vaccination or a blood draw occurred. That would be um, more anxiety than we would hope for them to experience. It's also really important to think about getting extra help when you can't get your child needed treatment. For example, I know someone who needs a particular procedure that requires blood draws, but they're too afraid of the blood draws to get it. So it's hard for them to follow through on a needed intervention for their health. That's obviously makes it a more urgent issue to get care if you're afraid of needles. If with the suggestions we've given that you've tried some of them and they don't seem to be working for you, and the child continues to show distress before, during, and after the procedure, and obviously it's probably normative. It is normative for kids to cry a little when they're getting a shot. Some don't, some do, but it's still normative. But if you see these kinds of things, then you might want to seek additional help. So if thinking about shots, blood draws, or medical procedures is affecting your child's functioning outside of a clinic visit, then think about added actually getting that mental health care. Those things are like not sleeping well, not eating well, a loss of energy, a developmental regression, which just means doing things that are for younger than their age, or having more separation anxiety, or any dramatic change in behavior. And by the way, I'm going to tell you that if any of these things happen at any time, you want to talk to your pediatrician and sort of think if mental health care is in order, just because these are signs that your child isn't functioning well. Well, I want to say one more thing before we go to our thank you, which is all of these strategies, these are a lot of strategies. You've all been what a great audience. So thank you all for coming. We really appreciate it. But what I would say to you is that um, individualize what we've said for you and your family based on your values, your child's likes, your child's need, what you know your child best, and what they would benefit from and who they are, which strategies will work best for them. So Gail knew her son would like those baseball cards. With my daughter, I didn't actually give her any prizes, but she really liked to rehearse for herself the cognitive strategy. She would say, I'm getting this so I won't get the flu. I'm getting this and I'll never get the flu so badly as other kids if I get this shot. And hopefully everybody gets a flu shot. I tried to get her on board about those kinds of missions early on. So just even thinking about individualize this for your family. And then to our last thank you slide.
I can say, I have to say, for my family, my kids didn't have fast food except on special days. And when Burger King was where we went after any kind of difficult poke, because that was a very special thing in their world, in our world. So thank you everybody for coming. And anybody who has a question, please put it in the Q&A. We have a couple of questions there right now. And I'm going to go with the second question first, which is, would you recommend to have shots at the start or end of an annual checkup, given that the child knows it's coming? Elisa and Gail, do you have any thoughts about that?
I think part of it depends on how old the child is. And I want to say part of it is knowing your child and what they would benefit from. Anticipatory anxiety can make things harder. So I think I might talk with your child about when it might be best for them to get that shot. And very often, if they're considering and thinking about getting a shot the entire appointment, then they're not able to participate in answering or I don't want to say enjoying the rest of a medical appointment, but feeling okay for the rest of the appointment if they know that's coming. So I think having control is a big part of it, is something that I would say and talking to your doctor ahead, because sometimes they have their rigid ways of doing things as well. Because, my doctor told me to lie to my child, not lie. She said, "Don't tell her. What are you telling?" I said, "It's time for your shot now," because they were trying to sneak it so she didn't see it. And I didn't, I said, "Hey, you're going to get your shot now." And they were angry with me. And she didn't, but she did better. She was going to do better with knowing. And I had already been working at Children's for a number of years at that point, so I didn't really want to do it that way. But I think know your child. I think very often, if you can say to your pediatrician, I think she'd like to get the shot done first, that's very empowering, and it gives a lot of control for a child to do it that way. But Gail, what do you think?
Yeah, I agree. I think ask a child who's old enough to know way in advance or to know beforehand is also old enough to say, what's going to be easier for you? Is it going to be easier to just get it done and then we can do our regular checkup? Or is it going to be easier for you to put it off as long as you can? So, and that does, again, it's an acceptable kind of question to ask where the answer is not a no, but it's yes before or yes after.
It's a
Um,
controlled choice, as you said, Gail. And I
exactly.
also want to say, Gail told you this, but I'm going to say it again. It's just like you don't want things that are simply delay tactics. Because when kids say, "Can I get it in 5 minutes?" they mean, I hope 5 minutes there'll be a series of 5 minutes, which mean never. So
Right.
so I know Gail already told you that, but in this case, I think that was a great question, because it's also knowing that you know your child better than other people do to know what's best for him or her.
Right.
And
And
we have
that's
a few
one.
more. Oh, go ahead,
Yeah.
Gail.
No, and it's very important to recognize that you're the parents and you do know your child the best. And, you know, recommendations are recommendations, but they're not necessarily right for your child. And so you work with your child, you work within what, um, works for you and your child, and trust yourself.
And we have a
Before
few
you
more
ask
great.
it, can I just make one more point before I forget? I'm sorry, and I want to hear the question. Sorry, Annie. So
Okay.
we just want to let you guys know that the Family Medical Coping Initiative is going to do a series of talks, if I didn't tell you that. Our next one is going to be staring questions and teasing about a medical condition, which probably be applicable for parents who want to figure out how to respond to those things, as well as for how to help your child respond to those things. But anyway, I'm sorry about that, Annie. What's our next
No,
question?
no, that's okay. We have several great questions and about 10 minutes, so I think we can cover this. Please send in more questions if you like. So here's a question: is there a preference between using actual medical equipment during play versus toy medical equipment, such as real blood pressure cuffs, syringes, etc.?
Mm,
And I'm going to toss that to you, Gail.
I have ideas
Um,
too.
Oh, and
yeah,
Elisa
well,
too. Sorry.
I think it depends a lot on your child, again, on your child, their age, their development. Um, very young kids that are like toddlers and I think the play medical kits are good, but a child who's had a lot of experience in the hospital, I've worked with children who've been oncology patients and they know all the equipment. They really, like a 2.5-year-old, might really enjoy and understand and appreciate using the real equipment. Whereas the average child who hasn't had that kind of exposure does better probably with the pretend kit. And then as they get older, and they understand more about medical procedures, I would then go to the real equipment. But Band-Aids, things that they see all the time, is great to incorporate into their pretend medical kits.
The piece I wanted to add, though, is depends on how serious their fear of the objects are. So if kids are very afraid, I agree with Gail and everything Gail said, and the real kids enjoy being in the control power position with a monkey that you can buy with long arms, or a doll, and being the doctor or nurse or technician themselves. They really enjoy that. But many kids are too afraid to use the actual medical equipment, even touching it, or kids who've had a lot of procedures are sometimes very phobic of those actual things. So sometimes you have to start with things that are less scary, and a plastic, very fake tool might be where you need to start with a child who has more fear, and then work your way up. And we're sort of thinking of beating anxiety, you have to do it by starting at an easier point, and fake equipment is an easier point than realistic equipment. So working your way up from something that's not really realistic, so it feels less threatening, to something that's more realistic might be necessary for someone who has a greater fear level.
Okay, next question. A great question. Can you send this talk to us? Somebody wants to share it with others? Absolutely. We will send you the PowerPoint slides, and the recording of this will be available on our website.
And maybe YouTube we're talking about.
And maybe maybe YouTube. We'll keep you informed. This is my child is 3.5 and she has a big hospital visit coming up. How soon do I tell her? And I love the holding ideas. We use them and practice at home, so it's not only a doctor's thing. So a 3.5-year-old child, how soon do you tell them?
Well,
It depends on the kid too. Yeah.
We have a kind of a rule of thumb that we go by, but I don't completely go along with it. The rule of thumb is 1 day per year of age, but telling a 2-year-old 2 days in advance is too much, is too soon. So I would think, and even for a 5-year-old, 5 days. So I would tweak those numbers and do less than their age, but it also depends on the personality of your child and how anxious they get. And you don't want them losing sleep for 3 or 4 days. Some children do well knowing the day before, some of them better in a few hours before, but you always want to have time to prepare and talk about it so that it's not just a shock. So it also depends on what your schedule looks like.
I would also say this, two other things to add in. Tell your child when they're going to hear from other people, or when, like, if they're going to go to an appointment and hear about their procedure coming up, you have to tell them if they're going to hear and know. So, I that's one thing. So, like, you have to tell the information when a child's gonna find out another way. Things are always better coming from parents, whatever time. I had a slightly different formula in my own head about timing, which was the day before for preschoolers, a day or two for elementary, and then for a child who's a little older, but maybe not, like, sort of like that tweener, like maybe a week before, 3 to 4 days to a week, and then for teenagers at the same time that you would find out. But that's with the caveat, depending on your child. If they're a very anxious child, you're going to adapt, just as Gail said. The thing that we're trying to avoid, many times people would tell their children about a procedure as they're driving them, would tell them, we're going to McDonald's, and then instead swerve into the hospital. And like, wait, this isn't McDonald's. That actually creates problems. I've had kids who've developed fear of cars, refusal to go places because they think they're afraid that they're just going to be put in a car and taken somewhere. So you do want to tell them, but not right at nighttime, also when they're going to go to sleep, before bedtime. And again, using those timelines Gail and I were talking about.
Here's a question. How does a newborn have a blood draw? And I'm wondering how to soothe him. Where will the draw be, and how can we keep him still for long enough? I know you talked a little bit about ways to hold, Gail, covered holds, but any other thoughts about this? About where a blood draw might take place for a newborn?
It depends on the amount of blood that they need. A lot of time it's a heel stick. And if they just need a drop of blood, that's a typical newborn. But if they need to put in IV, it'll be usually, I think, in their arm. And again, nursing a baby is a wonderful way. I know some people feel like that's may be a negative association, but it's found to be a very positive thing for newborns to be nursing while they get their pokes of any kind. And again, the Sweeties is a great way to help reduce the pain and discomfort. But it depends on the amount of blood they need and the nurse and your child, because if they're have chunky little arms, it might be more difficult to get an IV there. So, but generally speaking, I think most newborns get heel sticks is how they get their blood.
Okay, next question. Thank you, Gail.
Mhm.
Can parents get the pain relief patch days ahead of a shot or blood draw, or is it something we have to wait upon arrival to the appointment?
So I'm not sure if you can get a prescription for a Sanera patch, but you can definitely get a prescription for the EMLA cream or Elamax. As a matter of fact, I'm not sure if they're still doing this, but Boston Children's Hospital a few years ago were giving out free EMLA and Tegaderm, which is the type of bandage that's best, from the pharmacy. So if you're at an appointment and the doctor says, oh, you're going to need a blood draw today, you could go to the pharmacy, pick up your free EMLA and Tegaderm, and then put it on before you head down to phlebotomy. I don't know if they're still doing that, and I don't know if things have changed because of COVID. A lot of things have changed because of COVID, but you can definitely ask your doctor for a prescription, and you can also purchase the Tegaderm bandages, which are a clear bandage that you put on top, so you can see the cream through it, and it just should be like a bubble of cream on their arm. Or you can, if it's a blood draw, you can also ask, if you have time to wait, you can go down to phlebotomy, tell them you'd like to use it, and then the nurses can show you where to put it, where the best veins are, and if they're not terribly busy, and help you do that so that it ends up being, they'll have two options of where they can get the blood.
Thanks. And I feel like I'm rushing us along a little bit, but we have some great questions in just a few minutes. So I'm going to
Okay.
go to the next, if that's okay.
Yeah.
That's an excellent question. How is it best to notify those who are doing the blood draw or vaccine about a needle phobia? How do you make sure the technician can be as helpful as possible?
What a good question.
Excellent question.
I think it's the same kind of honest communication that you're going to do to your child. You can say, just want to let you know she or he is scared, and I've told them that they can do this. Whatever, remember that whatever you're saying to the technician, also saying to your child. And that's how you hopefully that person says something calm and encouraging. We hope so. I think we have great staff at Children, so hopefully they would. But I think I would alert them. If it's your own doctor and you're going in for a pediatrician appointment, I think I might tell them ahead, let them know that that's going on. Sometimes I might ask them, can we go right to a room? Ask, if you can diminish the wait time, because that anticipatory anxiety is part of it. But I think, remember that what you say to that technician or that nurse or that doctor, whoever's giving you the shot, is also being said to your child. And it's really good practice for self-advocacy too, which is they're kind of scared. I know they can do it. Go in there with positive statements about how you believe the child can do it, as well as that they're afraid, and you wonder if there are things that they know that can make it better.
And they can set up a behavioral preparatory plan as well, right? For the clinic or for a proper space.
Yeah.
You can
also request the support of a child life specialist. There is one that works at least part-time in phlebotomy, and you can call ahead and find out when she or he will be available, as well as in various areas of the hospital. Child life is in many areas of the hospital to help out.
Thanks. I hope that answers your question. This is, can you speak to how helpful or not of shot blockers? Good for 3 to 5-year-olds?
A shot blocker?
What is a shot blocker?
I'm not sure.
I'm not sure what that is either.
I don't know what it is. I'm going to have to look that up.
Sorry, we can't. Sorry, we can't answer that question right now. We have more excellent questions, but another one is, when you have exhausted all the techniques, is it ever okay to go straight to holding down the child to get the shot done?
Oh boy.
That's a really hard one.
I'm looking up shot blockers. Sorry.
Okay. Well, we have about one minute left.
It looks like it could be it looks like it might be very similar to a buzzy.
Okay.
And I'm not 100% sure, but if it is, what it does is create a distraction kind of pain and gets your mind thinking a different way. So I'm thinking, yes, I'm feeling like, and Gail, I'm curious what you would say about this. I would say it's much better to have somebody in control and able to participate in a shot as they can. On the other hand, if they're missing out, it depends on how serious it is to get them that medication and how
Right.
serious that blood work is. And if it's a life or death issue, you're going to do whatever you can. That's going to take precedence. The medical needs are going to take precedence over mental health needs. But from a mental health perspective, it's to be avoided as much as possible, holding down a child to do it. If you must, if that's like feels like absolutely critical, and maybe you've tried some of these things and they're not working, I think I would really scaffold it for the child, which is, we're going to hold you we're going to hold you because that makes it easier for you. That makes it possible for you to get this medicine, for us to get this information. But, we're going to hold you and then we're going to do X and then give them some control over something. But I think it's almost, I don't think I've had to do that with my patients in a very, very long time. So hopefully not. I exhaust other possibilities first. But if it's a life or death medical situation, obviously that has to take priority. But if I did, I would scaffold it. I would do it not out of anger. I'd almost do a second visit and make it planful that that's what you're going to do, as opposed to after a huge fight, a huge begging and pleading and chasing a child around a room, etc., then restraining them for a shot. I don't know, Gail, what do you think?
Yeah, I agree. If it's something that you can put off and do a better planning and preparation, I would do that. But if it's urgent, and many times it is urgent, then you have to do it. And you do the best you can to minimize that. And even depending on the age of the child, say, if you can't cooperate, we're going to have to hold you down and I'll give you a big tight hug. So,
But
but you
then
also have to make
don't
sure
punish
they're,
them later. Don't like if you
yeah,
have to do that, don't punish them. Remember, getting that done to them was an ordeal enough.
right.
And then
But
I'd say to them after, if you're angry, you might be angry and upset and embarrassed. If you can hold that in and say, I know that was really hard for you. That was really hard for us. Let's do something now to calm down. Let's get our coping together. Doing what you can to regroup and give them control, but also try to move beyond it so that their pairing of the experience isn't only the shot, the being restrained, and also your anger and distress after. I think what you want to do is shift as quickly as you can to something that indicates return to normal and their own body control.
right. And the other thing to point out to the child is that it's very important for them to be safe and for you to be safe and for the nurse or doctor to be safe. And if
Yes.
they can't stay still, no one's going to be safe if they're getting a needle. So that's when it would come down to putting a child in a situation where you make it so that everyone is safe.
I realize that it's just after 1 o'clock and we have a few questions that we haven't gotten to. And so I'm hoping that we can get directly back to those of you who have asked questions, and we'll try to get back to you. And I just want to say, or we want to say, thank you so much for coming today. We're so glad that you did, and we're so glad that you posed excellent questions. I'm sure, and if you have others, please let us know.